Hi, I'm Dr. Jeff Dolgus, and today I'm going to show you how to unlock a locked jaw. First, I think it's important that you understand why your jaw is locked. And of course, the best thing to do is to find a TMJ specialist in your area so you can get a proper diagnosis. But if you can't do this, there are a couple of quick tricks that you can try that might help you unlock your locked jaw. Now, right off the bat, I want to give you a word of caution. It's a really bad idea to forcibly manipulate a locked jaw. So if anybody wants to force your jaw open, whether you think they're an expert or not, do not let them do this because it will make the problem worse. I've personally watched and witnessed so-called chiropractic adjustments to the jaw. They were brutal, and I would not recommend them to anybody. If you visit a chiropractor or a physical therapist or massage therapist who wants to do trigger point release or myofascial therapy using instruments or using manual manipulation, that's fine. All we're doing in that case is trying to loosen up tight muscles to get the jaw to be able to move more freely. That's okay. But the thought that you can forcibly manipulate a condyle back on to a dislocated disc is ridiculous. It should never be done, and I do not recommend it. Okay, now that we've got that out of the way, let's get started. First, you need to try to figure out what's causing your jaw to be locked. An easy trick is to know how far the jaw can open when it's a joint problem. Usually that's around 22, 23 millimeters max. So if you have an acute internal derangement or an articular problem, you can use a simple cork like the Buffalo TMJ Kick the Click cork that's available now to measure that 23 millimeters. You use the short end of the cork and you see if you can open that wide. Now if you can get to that distance but you can't go any farther than that and it feels like a hard stop, like you're dead stuck right there, it's probably an intra-articular problem or a disc dislocation. If you open to that distance of the cork, that 23 millimeters, and you can go a little farther than that, and if you take it easy and relax and breathe, you can begin to open slowly a little further, then you're probably dealing with a muscular problem. Also, if you can't even open as wide as the cork, the width of a typical common wine cork, then you've definitely got a muscular problem, but you also might have an intra-articular problem on top of it. This is where diagnostic imaging, and in particular MRI, is very important. So if you feel like you have a muscular problem, the first thing you should do is apply moist heat for at least 5 minutes, preferably more like 20 minutes, and then measure your opening again and see if it feels any better. In my office, we use these corn bags, and I sell these to my patients. They're made locally by a very talented craftswoman. Here I have my American flag Independence Day corn bag in honor of the 4th of July that's coming up. They're filled with corn, as the name would imply. So when you put them in a microwave for about 1.5 to 2 minutes, they get quite warm, and they stay warm for a long time, and they generate a moist heat, which is more penetrating than a dry heat would be, and it's more effective at reducing muscle tension. These also have a little ribbon attached to them so that you can tie them up over your head like so. Wonderful. I should remind you, it's important that you take a measurement before you apply moist heat so you know where you started. You can use your fingers to take these measurements, and you start with one finger up to the first knuckle, and then one bent knuckle, and then 2 fingers up to the first knuckle, and then 2 bent knuckles, and then finally 3 fingers up to the first knuckle is considered to be maximum range of motion or reasonable range of motion for most human beings. Now, if you think your jaw is locked because you have an intra-articular problem or a disc dislocation, then there are a couple things you could do to try to maneuver your jaw so that it'll open past the disc. This condition usually happens because we constantly chew and squeeze and force the condyle of the mandible up into the socket, and eventually it makes its way behind the articular disc, which slips forward and causes the jaw to feel stuck. So the first thing I want you to do before you try this is look in the mirror, open as wide as you're comfortable, and see if your jaw goes off to one side or the other. Usually, if it's an articular problem, the jaw will move in the direction of the problem or the affected joint. So if you open a little bit, or open as far as you're comfortable opening without forcing it, and your jaw drifts over to the left, then it's most likely that you have a left joint problem. So I'll use that as an example. Let's say I look in the mirror, my jaw opens, it drops down, and it moves a little bit to the left. And I also feel like it's stuck on that side, and I feel tension over there, and maybe I have a history of my jaw clicking on that side, but recently it stopped clicking. So these are all clues that what you have is a disc dislocation that's not reducing. Now, if you think that you have an intra-articular problem, meaning a disc dislocation on one or both sides, what I want you to do is find a wine cork. Of course, I prefer the Buffalo TMJ Kick the Click corks, but you could really use any old wine cork from any old wine bottle. What I want you to do with the wine cork is place it in between your front teeth, the short way, where you can get to, and I want you to gently roll it back and forth, side to side, front and back, and just play with it. Let the muscles relax as you're doing this, and play with it as much as you want over the course of a day, as much as your muscles can tolerate. You don't want to push it too hard, and you don't want the muscles to get sore, and of course you don't want to overwork or overstrain these compromised joints. Now, even though I can't guarantee that this is going to work for you, I can tell you that it is possible and it's safe. I just had a patient last week who I sent home with a cork, and her jaw unlocked within a few days. The last thing that I want to say is I want to stress to you that even if your jaw unlocks, it's very, very likely that it's going to become locked again. When you clench on your back teeth, you're going to drive the condyle behind the disc again, and there's a good chance it'll get stuck there. And this will continue unless you take steps to correct the problem. So if you really want to protect your jaw joints and prevent them from becoming locked permanently, it's probably a good idea for you to visit a TMJ specialist or someone who is very knowledgeable about the anatomy and function of the temporomandibular joints, and get yourself an orthotic device. Well, I hope you've enjoyed this tip, and I hope you found it helpful. If you did, please hit like and please subscribe. If you have any questions or comments, please leave them below. I'm Dr. Jeff Dolgus. I'll see you next time.